Now we're going to go over identifying testing sites. In this case, we've identified a patient who has complaints of low back tenderness. We're going to be testing this patient by use of the algometer. The algometer, which we showed in the introduction to all the testing equipment, is designed to place tenderness, measure pressure at a certain point. So what we need to do now is to identify locations to where a patient has high levels or severe pain, which we will be using as a symptomatic site. We're going to have 2 symptomatic sites, and then we need to find 2 separate locations where the patient has little to no pain, which will serve as our control sites. So we're going to ask the patient the level of pain. Kind of cheated in that we've already identified locations, but for basic understanding, we will find spots in their low back. So say in this case, we haven't already marked the spots. So we're going to be looking for areas where there's high levels of pain and then control areas where there's no pain. So you ask the patient, is this tender?
8.
Okay, so he has been instructed to report pain level by the VAS scale and has indicated an 8 out of 10 in pain. So this will be our symptomatic site number 1. We will now try to find a control site on this side. So is this painful here?
1.
Okay, so it's not painful there. That will serve as our control site. So this is symptomatic site 1, control site 1. We can mark these with pen, or we can use different colored electrode tabs to identify our symptomatic and control sites. So he's complained of low back pain, so we know he's going to be tender over here. Is that tender?
6.
Okay, so we know that's going to be a 6 out of 10. And now we're going to try to find another spot.
1.
Okay, so this is a non-tender site. So now we've identified our 4 sites for our complete test. Again, EMG3 and EMG4 are then to be placed near our testing site. Ideally, we want these to be placed near the symptomatic and control site, and ideally to have them at similar locations on opposite sides of the body if possible. When we do the test, we now have a spot where we know we're going to be able to apply our pressure and measure his physiologic response to tenderness.